All right, we're just now starting our stream. Welcome everybody on LinkedIn who's been waiting all week for this moment, because Symphony RM has partnered up with the Healthcare Rap Posse, Jared Johnson, to educate and discuss the quest on becoming a data enthusiast. Some of the background around that is Jared Johnson has been promoting on his podcasts, specifically the Healthcare Rap podcast, on a shift that's happening towards a more data-driven perspective in marketing. So we're really glad to have him share his knowledge and his background from organizations like St. Jude, Phoenix Children's, and then a whole slew of hospitals that he's working with across the nation right now. So welcome aboard, Jared.
Thanks, Chris. Delighted to be a part of this today.
Awesome. And also internally at Symphony RM, Sarah Coles. She is actually our head of marketing services. And we were really excited to bring her on and have a conversation with Jared too, because like Jared, she's leading marketing initiatives all across the nation. And because we're a technology platform, she's kind of in the zone as far as helping to drive a shift towards a more data-driven perspective on in healthcare marketing. So, hey, Sarah, any thoughts from you starting off?
No, I'm excited to be here, Chris. I'm looking forward to the discussion.
Okay, great. Well, before we get into the questions, just wanted to say that this streaming platform, going with LinkedIn Live and going online and streaming, is actually, it was pretty new to us a few weeks ago, but we've gotten so much support, and we've been looking at who has been commenting and who's been joining, and we just really want to give back. So that's why we're bringing in people like last week we had Craig Karchner, this week Jared Johnson. And we're looking at our audience, and we're looking at healthcare marketing as kind of a nexus in terms of just where our core audience is. But there's a big support from the physician liaison community, big support from IT and operations coming in here. So we're going to have people come on. We've been talking with Kelly Knott on the physician liaison side, Edward Marks on the IT side. And we just want to keep bringing in these guests and keep that education going on some of the latest and greatest happening in healthcare marketing. And just for a personal story, before we get into the questions, if you look at my hair, I haven't had my hair cut since early March. And I don't mind it, it's coming in pretty clean, but I just got a text from my barber the other day, and he said, "Hey man, I miss you." And just letting you know, I have masks. I'm doing social distancing in the practice where we can. Like, I just want to make sure that you understand that you feel safe coming in. And with all the questions that we've gotten on previous webinars about bringing patients back, bringing customers back, I was just thinking about how my barber was just really focused on using a channel, SMS specifically, to assure my safety and just let me know that it's safe to come back to the shop. So just wanted to put some thoughts out there about how frequently we're communicating with our patients, how frequently we're communicating with our population. If we're doing the right thing, healthcare marketing is on the front lines, and patient engagement are on the front lines of getting the word out about the return to being in business. So just a thought on a personal story.
Yeah, so, and I would say to that, Chris, props to your barber, because he's using SMS and he's ahead of the curve, and he's messaged you at the right time with the right message. And, it's really kind of a testament to, how communications is moving forward in marketing. So props to him.
Y'all, my barber is dangerous. So I sat down in his chair last year and I told him about Google Ads and how that works in Atlanta. And now he's using SMS as a channel, Google Ads and things like that. So look to my barber for the future.
We will.
Okay, so we're going to go ahead and get started. So this is about the quest of the data enthusiast. Some of my questions might be a little bit facetious, but it's all in the idea of just helping to understand the importance of data science, ethical use of data within a healthcare marketing context. So starting out, question, I'll start for you, Jared, and Sarah, you can chime in however you want to on any of the questions. But marketing, as I understand it, is about creativity, passion, relationships, personal connections. Jared, what does data have to do with any of that?
It's kind of like the eternal question, right? So in my mind, data answers questions about where to focus that creativity and those relationships, because marketing is absolutely about those parts. But data helps us understand where to focus those parts. So where do you start? Where do you target? How do you know people at scale? Like, where do you deploy that creativity? Which relationships do you focus on? Those are the types of things that data helps us answer. Otherwise, the creativity and the relationship building is overwhelming, and it feels like it's the entire world that you have to spend time on. And so even just from one standpoint, being able to understand where to focus that and where to deploy that, that's definitely a starting point for me in terms of where data helps. So that kind of helps us understand, like, what is a data enthusiast, and to me that's a starting point also. So a data enthusiast, to me, I think, I hope it's not too bold to say that the data enthusiast really is one of the most important roles in the organization. And here's why. You've got your data champions, you've got your data scientists. Hopefully, you've got those who are digging in every day, who are mining the data and discovering insights, and they're sharing them, and they're understanding things. And that's the core. That's where you start. Then you need this. You really have everyone else who's at varying levels of understanding of when they get handed some insight, some data, and any numbers at all, their level of understanding varies widely. So the data enthusiast, in my mind, is the bridge. They're the translator. They're the one who helps take the gold straight from the mine and puts it in the hands of people and helps them understand, here's how you use this. So we absolutely need data enthusiasts. We need those who are well enough off to understand what they're being handed, but then also realize I have to translate this. I mean, data is a language, so I have to translate this to everyone internally just as much as I do those external audiences that we are using that data for. So just starting points.
Very powerful way to look at it. What it sounded like to me at the very beginning of your answer was, passion, creativity, personal relationships, but where are we directing this? And it sounded like data is kind of a guiding light to say that we should be, rather than trying to do everything for the entire market or entire population, let's find the areas that are most needed. Is that pretty accurate?
Yeah, 100%. In fact, in Seth Godin's book a year ago, This is Marketing, he talked about that a lot. He said, not only is marketing not mass anymore, because that's the old world version of marketing, is mass advertising. Those things are synonymous with marketing. And now what data tells us is that not only does it waste your dollars to think of everything in mass, but it also annoys people. So you are actually weakening your marketing relationships if you're not doing it in a focused way.
You've converted me. I'm now a believer in data. For the audience, everybody in the audience, everybody watching, we appreciate the likes and the claps coming in. That makes us feel awesome. If you have questions or comments, this is entirely unscripted, so feel free to chime in with any questions or comments or anything like that, and we are happy to answer live. So Sarah, could you share your perspective? I just asked Jared basically, what does data have to do with marketing? What's your perspective on that?
Well, I would say data has everything to do with marketing. And to your question earlier about, can you be creative and use data at the same time? Absolutely. And I think we apply creativity to campaigns every day, but we're testing them. We're testing and learning from them. We're applying it in a system that allows us to track what image is resonating, what message is resonating, what call to action is resonating. So it's a nice blend of both creative and data-driven insights. A/B testing is something that's really important in marketing, and it helps us to understand not only what creative is working, but who is it working with. And so we can really drill down and see, this creative resonated with this audience segment, maybe not so much with this. So we'll try a different creative approach with this other audience segment. So it really allows us, as we were saying, to kind of personalize and customize messages over time, but with a creative, touch on top. So.
Wow, I really like that perspective too, because what it sounds like is data plus creative is a feedback loop that ultimately helps where the data helps the creative get better, and the data identifies opportunities for the creative to be used.
Yeah. And I think to the point earlier, we talked about relationships too. That actually helps build the relationships over time as well. So the person who's receiving the message feels like it's customized to them. And we talked about your barber at the beginning of this. I'm sure when you got that message, you felt like it was a personalized message. It was something that resonated to you. It may have been sent to others as well, but it was sent to you because of something you had done in the past, some data your barber had on you, that he knew that message would resonate. So really understanding what your audiences are engaging with over time and learning from them allows you to be more creative and apply the right message.
The personalized aspect did make it way more meaningful in communication.
Mm-hmm.
So I feel like there's a little bit of preaching to the choir here. I think that a lot of people who come here are enthusiastic about data. So, but there might be in their department focused on using data for their own purposes and things like that. But then there's the question of how to spread through the organization. One of the lines in the healthcare rap theme song is status quo, more like status no. So this is the healthcare rap. Come on, let's go. But really, what I'm trying to get at is when there's organizational opposition, when there is resistance to using a data-driven approach, just talk to me about any kind of resistance you've encountered to taking data-driven approaches, and how you've worked with like understanding their perspective and ultimately helping the resistors get to a better place with data.
Yeah, I mean, I can tackle this a little bit. I definitely had some times here where I wondered where the hate was coming from, right? You figure, I mean, we used to think putting data of any kind in anyone's hand was a good thing, and sometimes that wasn't the case. I feel like resistance comes when we don't consider our audience, not just the external audience that you are trying to market to, but the internal audience that you are sharing that data with. And I have been guilty as much as anyone of not considering the audience when I have done that, like when I have provided some data to somebody and assumed that A, they knew what to do with it, and B, that they agreed with it, and C, that it matched the narrative they already had in their mind. So there's some ways just to even think about that. It's to think of your internal stakeholders as a unique audience, just as you are segmenting everyone who you're trying to send your marketing messages out to, ideally with your data. You have to think of our internal stakeholders in the same way as an audience, and they are on a spectrum of how much they understand data. So, as the data enthusiast, I feel like the job that you have is to understand that, whether it's, I've gone so far as creating internal personas of our internal stakeholders that we're reaching, because there are those with a limited understanding of data. There are those who are like on the verge of becoming a data enthusiast. They know enough to be dangerous, so they're going to be asking different questions. And then there are those who are kind of in the trenches, the tried and true old world marketers who, through no fault of their own, the world of marketing kind of changed around them, but they don't know what to do with the data when you hand it to them. So I've got to provide it in a different format or in a different language to each one of those groups internally. And I feel like that battle, like I said, I'm as guilty as not doing this. And I've seen what's happened when I didn't spend enough time understanding how to package that up and do it. There was a case, so we built up a data team at Phoenix Children's, for instance, and we brought on a data scientist, and we built a MarTech and analytics team, and everyone's very excited about that. And so we started doing it was either weekly or bi-weekly meeting with the entire group, and everyone came in, and we had all sorts of, we thought it was a gold mine we were putting in front of people. And long story short, there were probably 2 people in that room who were digging what we were saying. There were 5 people in the room who were pretending to pay attention, and there were 3 people who were just utterly lost. There was just the spectrum of people. So we actually decided to stop doing the group meetings and let's do individual meetings with everybody, so we can understand how to tailor this entire package of data for you. So I think just recognizing like building that into your loop here, your cycle here, like every internal stakeholder is different. You got to package things up differently for them.
You made some great points there, starting with the internal stakeholder as your customer thing. That like working with various data teams, I've kind of seen the difference in perspective when the data team is kind of working against Jira and just working against a set of tasks versus truly understanding what the needs of their internal customer are and how to empower them to do their jobs in outreach to the broader market. So love that point. And also, I just wanted to highlight again that the idea on massive meetings versus individual meetings. Once you have those one-on-one sessions, you get a much better understanding, and you kind of build those people kind of become champions for the initiative. So when you're producing it for a broader audience, first of all, you have a much better understanding of what your stakeholders' goals are, and they have a better, like since it was one-on-one and you might have been introducing some complex concepts, they have a better understanding too, and can help build more support. So while we were talking, Kathy Rhodes had a great question, and I think it's really relevant. Sarah, I was wondering if you might want to tackle this one first, actually. Her question was specifically, are you looking at data in a 3-month or 6-month trends, for example, before you do a check and adjust? So that really speaks to kind of the time lag between the time that you're communicating and the time that people can actually take action on campaigns or ultimately convert into appointments, downstream surgeries, and what have you. Could you shed a little light on that from an optimization perspective?
Yeah, and I think optimization also kind of depends on the kind of campaign that we're running. So we're optimizing all the time, but we may approach it differently for a digital campaign, a digital ad campaign, I should say, versus direct mail versus email, just because the response rates are going to be different times for the type of channel that we're using. Like with digital ads, we often optimize sometimes even on a daily basis, depending on how large of the ad spend it is. But ideally, you want to look at trends over a longer period of time. 3 months is a pretty good benchmark to see not just what channel is working, what content is working, but what in terms of engagement, but what is the end result? So yes, I'm seeing that my email has a high amount of clicks on a daily basis, but are those clicks going to a article or somebody requesting an appointment? Are they actually leading to the goal that I desire? And that takes time. Because we're going to see email open rates pretty quickly. We're going to see click rates pretty quickly. We're going to see ad engagement rates pretty quickly. But the conversion rates take time. And often that's because, somebody may not be ready for that procedure yet, or, they have to go through paperwork, or, there's a process, there's a workflow to get them in to an appointment. But that's really where the money is. And that's what we want to be able to see, as a conversion driver. Is that campaign meeting the goals that we want beyond engagement? So yes, I think 3 months is the minimum, but we want to be able to make sure that campaign is doing what we want it to be doing while we're kind of waiting for those results to come in.
Fantastic. And one thing I want to say is that while you're encountering resistance, like Jared outlined a really great way to work with people, work on a one-on-one basis, so you can really tease out why they might be resisting or why they might not be understanding, and they don't have to do that in a public environment where they might feel that they might look like they don't understand or something like that. You can have that one-on-one conversation, but that can be overwhelming. Focusing on the negative can be extremely overwhelming and get us down in the dumps. So I want to take it to the flip side and really focus on our champions. So let's think about through Jared, just wondering, where have you seen the most support? Like, how do you find champions in other departments and people to work with you to help push initiatives through, especially when there's cross-departmental buy-in needed for a particular data-driven marketing initiative?
Yeah, that's a great question. I don't know if it's the same for every organization. Where I've found the most success there has been understanding what language people are speaking. It's similar to the question we were discussing previously. It's deeper though. It's like, what does this person care about? Not only what language do they speak in, what do they care about? So I can tell you, anyone in finance doesn't care about the activities that you're doing in marketing. They don't care how many campaigns went out. They don't care about reach. They don't care about how many times you posted on a social media channel. They don't care about those things. They want to see some results. They want to see some dollars tied to that. They want to see a cost per click. They want to see how efficiently you're doing it. And so why would I lead somebody, in finance or operations with a report that says, look at all the things we've been doing, all these lead measures. Let's talk about, lag measures instead. Let's talk about some results and where it led us. And that is different. A lot of marketing, I guess Marcom, it's easy to generalize, but I think a lot of Marcom teams were used to they'd all say, of course, yeah, we're providing data, we're providing metrics, and we're providing analytics. And they were producing a 15-page report of activities that they were doing with very little result, or they'd throw in a little bit of the demographic data from their digital platforms. Yeah, hey, we're reaching 65% women and 35% men and stuff like that. It can be easy to feel like you're providing data to people when it's really not that useful. And then you add the one part of, most people don't like to admit their lack of data literacy. So it just takes some time to understand. That's where those relationships come in, and you have to understand what matters to somebody right off the bat, or they will just they'll totally ignore you. Someone in IT, if they get the vibe that you don't quite understand the platform you're talking about, they tune out immediately. So there's a lot of nuance in your communication.
So I would just add to that too. I think on the other hand too, data is kind of like the glue that can bind all the stakeholders together at the same time. So obviously different data is going to be meaningful to different stakeholders, but at the end of the day, it's the data that kind of speaks to the success of the organization. And, that's going to mean different things to different people. Marketing is going to want to show and see the ROI on campaigns, and, finance is going to want to see that, at the end of the day, the bottom line has been impacted positively, and operations wants to see that we're being more efficient about how we're, reaching out to patients, and, clinical wants to see that we're improving health outcomes. So I think all of this kind of combined together paints a bigger picture and kind of brings all of these groups together, and hopefully in a way to support the organization together.
I got a great question coming in from the comments that is so parallel to what we were just talking about. And it comes from Mike Leonard. He asked, how do you get the team to agree on the definition of success? So Jared, you were talking about all these irrelevant metrics that are irrelevant to other stakeholders. How do we work with a particular stakeholder to figure out what is a definition of success that we agree on?
So I wish there was a way to make this work with everybody. I have not found what that is. I don't know that everyone in an organization is always going to agree on it. I do agree with Sarah that data can be the glue to help get you closer to it. So I've seen instances where at the end of the day, the marketing team was absolutely killing it and showing a demonstrated ROI of 7 to 8x, 7 to 1, 8 to 1, or more on a regular basis, was killing it, was bringing in money. They had all that to show, and leadership still said, well, we're not increasing market share, so let's kill that program. So I don't know if there's always a way, just being realistic. I don't know that there's some magic way to show that for everybody. What we can do is own the conversation and use data to drive it, right? So we can at least, if we don't come to the table with anything, if we come to the table with, hey, look how many times we posted, look how frequently, just some of the basic Marcom stats, from years ago, they've already tuned out. And so understanding what success is does require us to come to the table with more than what we traditionally have to even like say, hey, let me in this conversation. And the most success I've had with that has been when we do talk about like we see things as marketing operations, like no matter what it is. This is the investment. This is the return on our marketing investment. I'm not trying to get budget. I'm trying to show the return on my marketing investment. It's the way we talk about it. I've had more success that way. It hasn't always solved everything, but it has definitely changed the conversation.
I just wanted to chime in really quickly that a lot of times when I see people debating about what constitutes success, like, oh, well, we got a strong positive ROI from this campaign, but somebody else said, well, we're not generating market share, so I don't really agree that this is something that we should continue doing. A lot of times, like if one person is having a conversation about the value of an investment, whereas the other is having a conversation about how much market spread there is, that means that they didn't agree on what the problem was initially. So a lot of the time that I see people debating and arguing, I'm like, do you guys have a consensus on what's the problem that we're trying to solve? Just wanted to throw that in as an example, not saying it's panacea, but taking a step back and making sure there's an agreement on what the actual problem is has often been a big help. Any thoughts from you on that, Sarah?
Yeah, I'm sorry, Chris. I think there was something wrong with the connection. Can you just maybe it was on my end? Can you just summarize that quickly? And
we were just talking about when there's conflict between teams and people don't have a agreement on what constitutes success. I know that you've been involved in a lot of projects where you had to go through internal resistance to push data-driven initiatives forward. So seeing if you had any thoughts on, hey, what happened? How do we get teams to agree on what constitutes success?
Yeah, I mean, I think it's important to align on those success metrics up front, first of all, because that way we're all in alignment when we start a campaign or a project together. We try to meet with clients at the very beginning of a relationship and really understand, what are your goals for this year? What are you being measured against? What does success look like to you in your organization? And what are your corporate goals for the year? So that when we're thinking about campaigns and building campaigns, we're building it around those KPIs. And we're really partners working with them towards their overall corporate goals, rather than kind of going off here and doing campaigns on the side and kind of doing our own thing. It's really part of the overall organization's objectives. So I think aligning on that at the very beginning is really important.
Guys, we got another awesome question from the audience from John Marzano. So he brought up that I'd mentioned champions a bit earlier in the conversation. What are the thoughts on physicians, like on getting physician support? Like basically said, do the panelists find that physicians get and support this approach more than others in the organization?
I definitely feel like that's the trend right now. In recent experience, that is who is driving things. And you think about it, they come from an evidence-based field. So if you can speak their language, I do find them being more often the champions. They're not sitting there in hospital administrative speak. They don't come from that world. They come from an evidence-based world. And when there is more evidence to show them, as there is now than there was even a few years ago, they can hear case studies. They hear it from their colleagues and their peers more often than not, especially compared to even a few years ago. So yeah, I definitely see that happening more often.
What about you, Sarah?
I would agree. And I think that, done right, marketing can be a really great extension of physicians. And for what we've seen, they're really excited that, their patients can be reached and influenced and, spoken to almost in a way to help change behaviors and do it in a way that, is data driven, is customizable, is personalized, but also, we can measure it and we can show true outcomes. So I think we've seen a real partnership kind of growing between physicians and marketing.
Fantastic. And we are coming up on time. Panelists, do we have time for one more question, or do we want to conclude here? Jared?
Up to you.
Whatever you want to do,
All right,
Chris.
fantastic. Okay, great. We'll do one more question, and then we'll sadly have to close out. As far as the Data Enthusiast Toolkit, like what we've been focused on heavily was the organizational level, which I think that's key to getting things done. But then when we get into the execution phase and the tactical phase, I'm wondering if there are any technology tools that are vital for the Data Enthusiast Toolkit.
That was a great question. I think immediately to how can I make sense? Like how do I, what tools do I use to understand reporting myself? So, and that seems to be different for everybody, but whatever's the easiest way for me to manipulate the data and understand the story it's telling and the question that it's answering, sometimes that can really get in the way if you are, sometimes it's a dashboard. It can be anything from Google Data Studio, a dashboard that you create. But I've found myself spending more and more time just creating the way to report it, even to myself, just to even understand before I can share it with somebody. So I think those tools are going to be different for everybody, but sometimes that's built into whatever the marketing platform is. I mean, still at the end of the day, your CRM and your marketing automation platforms those are going to be the core of any data strategy for a long time. So those are essential. I feel like whatever the tool is to help you understand and really get the most out of reporting, don't let that get in your way.
And Sarah, any thoughts on that?
I have to agree. I think reporting tools are a data enthusiast secret weapon. I mean, we can't really prove and show the data without robust reporting tools and BI tools like Tableau and Looker. And, we use ETLs or even directly connect to tools like Google Analytics and Facebook ads. And so I think, again, like bringing all of that data under one roof is kind of like the golden ticket to be able to really report and see data holistically. So I'd agree. I think reporting tools are really where data enthusiasts needs to focus.
Fantastic. Love the answers. And I asked that question because to kind of bridge that gap, to talk more about technology, we'll be going on with Edward Marks, who was formerly Chief Information Officer at Cleveland Clinic, and he's got some great information coming out this year, Voices of Innovation, great books and things like that. So we'll have a conversation deeper on technology coming on the 29th. With that, thank you for sitting with us for 30 minutes. We just want to use this Friday time to get questions answered and share with experts and honestly learn even on the air. I'm learning from hearing from my coworker and from experts in the industry. So thank you very much for coming in and sharing this time with us. We really appreciate it.
Thank you.
Thanks, Chris. Thanks, Sarah.
Bye-bye.